In this video, we discuss laser interstitial thermal therapy, LITT, a promising anti-cancer therapy. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. LITT is a form of thermal ablation used on the brain. It is frequently used for people who do not have complete responses to stereotactic brain radiation, that is, cyberknife or gamma knife. To perform LITT, typically only a 2 mm incision is made into the scalp, then a heat-producing filament is inserted into the tumor. Most patients are discharged the next day. Efficacy is fairly high. An analysis of 470 patients who had recurrence of brain metastases after stereotactic radiation showed the LITT produced a 6-month and 12-month local control rate of 67.9% and 59.9% respectively. The rates are higher when radiation necrosis is targeted, 87.4% and 76.3% for the 6 and 12-month rates of local control. LITT has also shown promise in glioblastoma. A 2017 study of LITT treatment of 41 recurrent glioblastoma tumors showed overall survival to be 11.6 months, whereas patients with recurrent glioblastoma treated with lomustine, a chemotherapy drug that crosses the blood-brain barrier, and avastin, a drug to slow the growth of new blood vessels, had a median overall survival of 9.1 months with a 40 to 60% incidence of serious adverse events. Neurocognitive deficits caused by LITT seem to be 10% less than those caused by open brain surgery. It is difficult to find comparisons of neurocognitive performance pre- and post-LITT in people who have not had any other intervention on their brain, but stereotactic radiation has actually been found to improve cognition in long-term survivors because tumors are either gone or reduced. So reducing the activity of tumors in and of itself has a positive outcome on cognition. The main limitations with LITT are that some lesions are by crucial areas of the brain and cannot be accessed. And the maximum size of a lesion that can be targeted is less than 3 centimeters. The larger a tumor is, the more vascular it will be, and consequently, it will be more likely to cause bleeding and edema. Any kind of ablative procedure, particularly in the brain, is likely to cause bleeding and swelling as a result. The dangers of this can be so great that they may prevent the physician from performing the procedure. LITT is also currently only offered at a handful of leading medical centers. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.